evening. Welcome to another edition of Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. They say a journey of 1,000 miles begins with a step. When it comes to health and protection, it begins with a single drop. We are looking at vaccines today, importance of vaccination. How true is the myth and misconceptions about vaccines in the 21st century? Stay tuned. The conversation begins after this break.
The program is a 3-year program and it involves training of health workers, providing mosquito nets and nutrients for malnourished children. We have also supplied equipment to primary health centers, as well as providing media information to the public. We believe that healthy mothers will produce healthy children and our nation will also be healthy.
Let's talk about nutrition in pregnancy and nutrition in children under 5. What is nutrition in pregnancy? Nutrition is everything that a woman needs for the growth of a baby. And it comes with diet. With proper diet, a child is expected to grow well in her womb, and then she needs that as the child is growing. For a child that is growing, a lot is going, and then a proper meal has to be produced for that child to grow properly. A child needs breastfed first 1 hour of birth, and this is called early initiation. During this period, that child has the advantage of taking the first milk that comes out, that is called colostrum. That's acting as the first immunization for the child. It happens for the first 1 week. Every child is expected to be breastfed for the first 6 months exclusively, without adding anything, no water, no drugs. And also, proper breastfeeding also help with easy expulsion of placenta and proper evolution of the uterus. After 6 months, there's a iron gap, and that's why we actually also advocate for proper complementary feed with continuous breastfeeding till the child is 2 years. And in breastfeeding, it is important to note that there are 2 kinds of milk, foremilk and hind milk. And if a child does not enjoy both milk, that child looks as if he's not well fed. So the timing of breastfeeding has to be long enough for a child to be able to benefit from both the foremilk and the hind milk. Any child that has been breastfed for the first 6 months exclusively is expected to continue breastfeeding and have complementary food, and that is family meal. The proper and appropriate complementary food must have adequate diet. It must be available, accessible, affordable, and what is advocated is the food around the community that the child can join with the family meal for that child to have proper growth. A proper diet gives a proper growth, and a proper growth
The program is still Sound Health on Lagos Television. Join us via Zoom this evening to talk about vaccination and disease prevention is Dr. Abba Umar. He is a health specialist with UNICEF Lagos Field Office, and he is going to tell us all we need to know about vaccines and the importance of immunization. Good evening, Dr. Umar, and thanks for joining us.
Good evening.
All right, Dr. Umar, despite the gains we've recorded so far for vaccines, why is it that we still have zero-dose children? Why is it that we still have hesitation when it comes to immunization?
Well, okay, thank you very much. I think you asked 2 questions. Why do we have hesitation, and then why do we have zero dose? In terms of the zero dose, most of the zero dose children are those who are located in very, very remote areas that are very hard to reach. They could be also nomadic communities. They could also be in urban slums. They are really, really quite hard to reach. That is why we still have the zero dose. In terms of hesitation, I think we've moved a lot in Nigeria in terms of vaccine hesitancy. I know if you remember in previous years there were issues around polio eradication, especially with rejection, but I think that has really moved forward. But I think the bottom line is whether the communities receive the information that they require to know the benefits of vaccines. I think that is the bottom line. Once you are able to, educate the population about the benefits of vaccines, people will normally receive vaccinations.
All right, at
Thank
this
you.
point, quickly take us through the benefits of vaccines before we look at the types of vaccines that are important for children for lifelong protection.
Yeah, okay. Vaccines, what they normally do is they protect you against certain diseases, mostly infectious diseases. And I give you an example. For instance, they can protect you against tuberculosis. They can protect children against polio, hepatitis, diphtheria, whooping cough, even some diarrheal diseases, as well as measles, yellow fever, and so on and so forth. And you know also there are vaccines that protect women against cancer, like the human papillomavirus vaccine. And you also know recently the COVID-19 vaccine that has been used to protect people against COVID-19. So there are so many of them, and they range from ones that you take during infancy up to adulthood, and even some at old age you can take them over.
All right, quickly take us through the routine for the vaccines, the immunization, which is necessary and at what stage of one's life is necessary, is important or key.
Okay, now first of all, let me start with pregnancy. Once a woman is pregnant, she needs to get protection against tetanus. And one of the reasons behind that is once she gets protected, her child is also going to get protected against tetanus. So that is really, really very important. Once the child is born, one of the very first vaccine the child receives is called the BCG. BCG protects against severe forms of tuberculosis in children. And then also you get the polio vaccine, which also protects against poliomyelitis. And then you get the hepatitis, what is called the Penta. The Penta is a combination of 5 vaccines that protect children against diphtheria, whooping cough, hepatitis B, and other diseases. As well, also you have other vaccines like the measles vaccines, which protect children against measles. This one is given at the age of 9 months. You also have a yellow fever vaccine, which protects children against yellow fever. And of course, there is also the rotavirus vaccine, which protects children against some forms of diarrhea. And of recent, there is also a malaria vaccine that has been introduced, which protects children against malaria. So there are so many vaccines. This can be taken before age 5, but there are others. For instance, in young girls from 9 to 14 years, they can be given human papilloma virus vaccine, which protects them against cervical cancer. And you also know that there is also hepatitis B vaccine, which can be given to children as well as adults. And there are other vaccines which can be taken by children, also by adults, whether young or old, like the COVID-19 vaccine. So there are a variety of vaccines, many of them, and that are used to protect people across all ages.
Thank you so much for that clarification. So what is the cost of not immunizing your child at the specific time?
Well, I think you can divide the courses into so many parts. Number one, it could be a demand. It could be a supply issue, or it could be a demand issue. What do I mean by a demand issue? Perhaps maybe at the appointed time of vaccinating the child, the mother takes her child to the facility, but maybe the services are not offered there, and this could be the result of maybe non-availability of the vaccine or some of the supplies that are being used. And it could also be a demand issue. Maybe perhaps the family or the community are not aware about the vaccines, they are not aware about its benefits, so they don't really look for it. So it could be either a demand challenge, or it could be a supply challenge that could cause family not to actually access vaccination.
Okay, oftentimes we hear people say this child was not vaccinated because of some myths and misconceptions held by his or her parents. At this stage, if you have the opportunity to speak to parents or prospective parents, what advice do you have for such parents?
Okay. First of all, what I want to say is every vaccine that you see that is being used goes through a lot of processes to ensure that it is safe and it is efficient. And before it even comes to the public, it goes through what is called certification by the World Health Organization. The World Health Organization certifies, looks at the vaccine, look at the components, and ensure that it is safe before it is to individual. So that is clear. So every vaccine that you see, every vaccine, you see in the health facilities that are given to people, they are safe, they are certified before they go to the field. So that is number one. So in terms of issue of safety, I think that is clear. But also one thing I want to say is when you give maybe some injections, some vaccines to children, sometimes there are reactions. These reactions are normally mild, and it also, for instance, if you can have a fever, transient fever if you have a vaccine. These are transient, and this also shows that your body is working and the vaccines is also working. It's good even to have the fever, because it indicates that the vaccines are working. So some of the side effects you see are actually a process of the working modality of the vaccine itself. So basically vaccines are safe, and every individual, every household should ensure that their children are immunized against the killer diseases, the vaccine preventable diseases.
All right, is it ever too late to catch up with any missed dose or dosage of vaccine?
Yes, absolutely. It doesn't mean that maybe because you are above 1 year, you have not received the vaccines. It doesn't mean that when you go to the clinic, you will not receive the vaccines. When you go to the clinic, they will ask you which vaccines you've received, or which, and they will ensure that you get those that you have missed. And even if you have not received any at all, the clinic will make a schedule for you to ensure that you receive the vaccines that you require. So it doesn't mean if you have received any, you can still go and get the vaccines.
All right, as we wrap up now, your final words to viewers at home, Dr. Umar.
Okay. My final word is to re-emphasize the fact that vaccines are very, very safe, and it makes our children grow very healthy. And every individual, every family should ensure that their children are fully immunized, are fully protected. The government of Nigeria is trying its best to ensure the availability of these vaccines, which are normally free. And also partners, development partners like UNICEF, WHO, and so on are also working together to ensure the delivery of these vaccines to the community. So I urge every family to ensure that their children are fully protected against these vaccine preventable diseases. Thank you.
All right, so I know I said your final words, but I quickly need to ask you these questions. What should be the first port of call when a baby or a child is experiencing a side effect? What should the parents do?
Normally, during the vaccination session, normally the health worker will brief the mother First of all, what the vaccine is about, its route of injection, and then the possible side effects. And then the healthcare worker will also tell the mother, okay, just in case there is this, please do this. For example, if the child has fever, just get paracetamol and give the child. The fever is transient, it will go. And sometimes also you can have coincidence that you receive the vaccines and then maybe the child is incubating another illness, and then people will relate it to the vaccination itself, which may not be true. So on such things, I think it is important also to bring back the child to the hospital to ensure that the child is examined and treated accordingly. But by and large, like I said, vaccines are very safe, and everybody should seize the opportunity to ensure that his children are fully immunized.
Vaccines are very safe. You should vaccinate or immunize your child at every point that is required. It is safe. Vaccines are safe and harmless. Dr. Abba Umar, health specialist, UNICEF Lagos Field Office. Thank you so much for your time and expertise on sound health.
Thank you so much, and bye-bye.
You're welcome. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television, and we have been looking at vaccines, the invisible shield for every child. Vaccines are safe, they are mostly free and harmless. You need to vaccinate or immunize your child at every point where it is required. Vaccines give herd immunity and protect the world against disease outbreak. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.